You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Folks in Washington, D.C. at a news conference this morning, Mayor Muriel Bowser asked shoppers to help keep grocery store workers safe. She wants them to limit their grocery store trips, shop quickly, and use a self-checkout lane when possible. Bowser issued an order yesterday requiring that all grocery stores comply with new social distancing guidelines. In D.C., all grocery stores and convenience stores must limit the number of shoppers, create one-way aisles where possible, and cease the use of buffets. Outdoor markets are no longer essential businesses. All farmers markets that wish to operate must obtain a waiver from the city. You know, that's actually kind of important, and we certainly appreciate that. All right, folks, let's talk about what is happening in St. Louis. Man, when we start looking at these numbers, and we've been talking about this for a very long time, how black people are being impacted. This has been happening all across the country. Nearby state, the next neighbor of Missouri, Illinois, where Chicago Mayor Lori Lightfoot sounded the alarm about the disparities. People are contracting and dying from coronavirus in the Windy City.
Numbers take your breath away. They really do. This is a call to action moment for all of us. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay. While we have sufficient data to see that these trends are alarming, as Dr. already noted, healthcare providers are still not providing total demographic information that is needed for us to have a complete picture of the impact. That must change. This is not negotiable. We must understand the magnitude of the impact of this virus on all of our communities, and it is up to the healthcare providers who are on the front lines not to skip over the boxes that provide us with the demographic information that's essential for us to understand the impact on Black and brown communities. You must do this, and we will order it to happen.
As I said, in St. Louis, that same alarm is being sounded. All of the people who have died there have been African-American. That's 12 people. Joining us right now is Dr. Frederick Echols, Director of the City of St. Louis Department of Health. Dr. Echols, welcome to Roland Martin Unfiltered.
Thank you.
We have been talking about this. We had the coroner from Albany, Georgia on this show. We've had folks from Mississippi, from Louisiana, from Alabama. We've had people from so many other states. And so what is happening there in St. Louis for all 12 to be African-American? What are their age ranges? Were there underlying conditions? Just give us some details to understand what's happening there.
Yeah, so we're looking at the data really closely here in St. Louis. For the individuals that have died due to complications associated with COVID-19 infection, the age range has been from the 30s to the upper 80s. And so the age is a wide spectrum of ages that are covered in that group. But the issue is that African-American communities across the nation, not just in the city of St. Louis, are disadvantaged because of the health inequities and health disparities that existed prior to COVID-19. And so when we look at the data, this isn't anything new. We see this day in and day out, year after year. But unfortunately, communities have chosen to ignore it when it's convenient for them. And so for the City of St. Louis Department of Health, we are adamant that this is no longer acceptable and serious actions have to be taken to address these issues.
And so you talk about that range, 30s all the way up to 80s, and we're seeing this. I mean, do you think it's going to force people to confront, we keep saying these underlying issues because this situation exacerbates it. And frankly, I think, look, we've always known, if you black, we talk about it. I've covered these issues for years, but it's like all of a sudden these white folks, oh my God, what? We didn't even realize these things were happening.
That's right. So our communities have essentially become desensitized to the fact that these inequities exist. And so it's up to healthcare providers, public health agencies across this nation to really stand up and be advocates for our communities so that they're empowered to actually live healthier lives and have equitable access to quality healthcare services.
And so what are you doing there in St. Louis to warn people, to give them information? I mean, we have been pounding the table saying, don't congregate, don't go to churches. We've been playing the videos from Marlon Wayans, what Tyler Perry said earlier today. We played the Stam Jackson Stay the F Home video. And so what is the very concerted effort happening there in St. Louis?
So the City of St. Louis Department of Health, we're utilizing all media outlets to make sure the public is well informed about the prevention measures, as well as the reason why we're making certain decisions as it relates to community mitigation strategies, which are needed to slow the progression or slow the transmission of COVID-19 in our jurisdiction. We are using non-traditional methods, so we're typically the health departments don't partner with some of the more prominent individuals that are in the limelight, so a lot of the famous individuals. So we've actually reached out to several individuals that are well connected to the public to have them advocate on behalf of the health department. Because with the health department, we're also a government agency, and so we have to acknowledge that oftentimes there's a level of distrust when individuals in our community, particularly communities of color, receive information from government agencies. And so working with the individuals that have working relationships with communities is really important. In addition to that, we're also working with a couple of agencies across the city of St. Louis, one being the Missouri Foundation for Health, Washington University, the Regional Health Commission, and the Integrated Health Network. And what we've done together is we've identified those areas with the highest levels of poverty. And we are working to implement a grassroots level campaign related to COVID-19. And this will entail having volunteers from across the region come together to canvass these communities to make sure they have accurate information so that they can be empowered and prevent being exposed to COVID-19.
Any questions from my panelists, Greg, Reese, or Erica?
I have a question. Thanks,
Erica, go ahead.
Hi. So my question for you, sir, is then with these deaths, specifically with them all being Black deaths, what are you or anyone from your team, what are you all noticing in terms of compliance? And then secondly, are you also working with other professionals within your network who may have stewardship over counties or cities that are predominantly Black, and what recommendations are they presenting to you?
Absolutely. So we are working with other organizations across the city. So earlier today, I had a meeting with the Clergy Coalition for the City of St. Louis. As we all know, effectively reaching churches and getting them to actually counsel service can be a challenge. And so part of our role is to make sure they're educated and they understand the reason why we're making these decisions. And so it's not to be punitive, but it's really to save lives. And once they understand that, they are more likely to comply with our recommendations. Overall, within the city of St. Louis, the majority of individuals are complying to provide a platform for community members to submit complaints for their neighbors or family members or whoever that may not be complying with our executive order that was issued a couple of weeks ago. We established a platform through our Citizen Service Bureau. And so if individuals are not implementing social distancing measures appropriately in the workplace, if they're having gatherings of more than 10 people, whether it's at a funeral or a church, et cetera, we receive those complaints and we issue cease and desist letters immediately.
All right. Dr. Nichols, Frederick Echols, Director of the City of St. Louis Department of Health. We certainly appreciate it, sir. Thank you so very much. Hey, fam, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.